Hello, and welcome to the protocol review video for the second perioperative anticoagulant use for surgery evaluation study, which is a randomized controlled trial also known as the PAUSE-2 RCT study. The aim of this study is to test the hypothesis that in patients with AFib taking a direct oral anticoagulant and having a high bleed risk surgery or neuraxial anesthesia, that the simpler pause management is as safe as the more complex Azra management. The study is currently in the pilot phase at sites in Hamilton, Ontario, to test study feasibility. The enrollment goal for this pilot study is 200 patients with AFib, or 100 per protocol arm. Over the next few minutes, we will be reviewing the pause visit schedule, patient screening and enrollment requirements, eligibility and consent, the DOAC interruption protocol for both pause and Azra, day 0 blood collection, follow-ups and outcomes, and frequently asked questions. As a reminder, only patients having a high bleed risk surgery or neuraxial anesthesia are included in the PAUSE-2 RCT. All low-risk surgeries are to be excluded. A potential participant must be screened and provide consent before being enrolled in the study. The date of enrollment must allow adequate time for the DOAC to be interrupted as per protocol. Enrolling a patient the day before surgery is not permissible because it will not leave enough time for interruption. After enrollment comes the surgery or procedure, with DOAC interruption before procedure as planned. Weekly follow-ups begin 1 week after the surgery or procedure and continue once a week for 4 weeks, resulting in 4 follow-ups total. Follow-up dates are flexible based on coordinator ability to reach patient or family member by phone. If a patient cannot be reached on day 7, try days 8, 9, or 10. If a patient cannot be reached on day 10, wait until day 14 and try again to ask them about the previous 2 weeks. The first form you will complete is the screening and eligibility form. On this form, there are several key fields to keep in mind. First, you must check that the patient is eligible to participate in the study and that the patient gives their consent. The patient must also agree to a day 0 or procedure day blood draw, or else they are excluded from the study. After this, you will randomize them to either the pause or Azra interruption protocol, collect baseline medical history and surgery or procedure details. Though ideally all pertinent fields will be complete, the most important information on this form is randomization, what DOAC the patient is receiving, the patient's creatinine clearance, the planned date of last dose of DOAC before procedure, and the planned date of procedure, as well as the type of planned procedure. Please bear in mind that the patient's creatinine clearance must be greater than 30 mL per minute to be eligible, or greater than 25 mL per minute if the patient is on apixaban. In addition, the PAUSE study does not require a new hemoglobin test to be performed, but it does require a hemoglobin test value. Please take the patient's most recent hemoglobin value from within the last 6 months. In terms of eligibility, please keep in mind that participants must be 18 years of age or older, be receiving a DOAC for AFib, agree to the procedure day blood draw, and be able to follow the PAUSE or Azra protocol, depending on where they have been randomized. If the patient does not meet the creatinine clearance cutoff, has a cognitive impairment or psychiatric illness, is unable or unwilling to consent, or has already been in the study and had their surgery or procedure, they are not eligible for the PAUSE-2 RCT. Additionally, if the patient is not having a high bleed risk surgery or neuraxial anesthesia, they are not eligible. Though the surgery or procedure codes are categorized in our guide as either low or high bleeding risk, a patient's treating physician may reevaluate their level of risk to be inconsistent with our guide. If this occurs, go with the physician's assessment and include a comment that the risk was changed for this patient at the physician's request. Please note the physician must still agree to follow the interruption protocol outlined for the level of reevaluated bleeding risk, which for this study, all bleeding risks should be high. Using information about the patient's DOAC, creatinine clearance, and bleeding risk, determine the number of days to interrupt DOAC prior to the surgery or procedure. This will differ by interruption protocol, and let's start with the pause protocol. If the patient is taking rivaroxaban or apixaban, creatinine clearance is not used to evaluate DOAC interruption. For both of these DOACs, the high-risk procedure warrants 2 days without DOAC. If the patient is taking dabigatran, creatinine clearance is pertinent to evaluating DOAC interruption. If creatinine clearance is greater than or equal to 50, 2 days of DOAC are to be skipped. If the creatinine clearance is less than 50, 4 days of DOAC are to be skipped. Let's move on to the Azra protocol. Again, if the patient is taking rivaroxaban or apixaban, creatinine clearance is not used to evaluate DOAC interruption. For both of these DOACs, a high-risk procedure warrants 3 days without DOAC. If the patient is taking dabigatran, creatinine clearance is pertinent to evaluating interruption. If the creatinine clearance is greater than 80, 3 days of DOAC are to be skipped. If the creatinine clearance is 50 to 80, 4 days of DOAC are to be skipped. And if the creatinine clearance is 30 to 49, 5 days of DOAC are to be skipped. Please see the Pause and Azra DOAC interruption scenarios video for more information about the interruption protocol for both of these protocols. In all cases, a day without DOAC constitutes 1 full calendar day without DOAC, not 24 hours or a certain number of doses. Thus, 2 Pause protocol patients on apixaban having surgery on a Tuesday, one at 8 a.m. and one in the late afternoon, would both take their last dose of DOAC on Saturday night, effectively skipping Sunday, day 1, and Monday, day 2. When you have determined the interruption protocol, provide the patient with a diary which outlines when to take their last dose of DOAC before procedure and when to resume DOAC post-procedure. We have one version of the diary for Pause patients and one for Azra patients. To illustrate the differences between the Pause and Azra protocols, let's practice with a patient and see if the number of days to interrupt DOAC is the same or different between the two. A patient taking Pradaxa is having a high-risk surgery. Their creatinine clearance is 45 mL per minute. With the Pause protocol, a person on dabigatran whose creatinine clearance is less than 50 would skip 4 days of DOAC. With the Azra protocol, a person on dabigatran whose creatinine clearance is between 30 and 49 would skip 5 days of DOAC before their procedure. Note that if the patient's creatinine clearance was, let's say, 75, this person would skip 4 days of DOAC for both protocols. Let's do one more example. A patient taking Eliquis is having a high-risk surgery and their creatinine clearance is 65 mL per minute. With the Pause protocol, a person on apixaban would skip 2 days of DOAC, regardless of their creatinine clearance. With the Azra protocol, a person on apixaban would skip 3 days of DOAC before their surgery, regardless, again, of the creatinine clearance. As mentioned earlier, the patient must consent to having a study blood sample collected on the day of procedure. If a pre-procedure blood sample is not feasible, collect a post-procedure blood sample as soon as possible on the same day. In this study, the blood sample will not be for clinical use. Plasma will be shipped to the core laboratory for testing. In terms of restarting DOAC postoperatively, when following the Pause protocol, patients are suggested to restart 2 days post-op, but this is at the physician's discretion. However, restarting 1 day post-op is strongly discouraged. When following the Azra protocol, patients are suggested to restart 1 day post-op, but again, this is at the physician's discretion. In this case, however, restarting 1 day post-op is encouraged, so make note of the differences here. Pause follow-ups begin 1 week post-procedure. Patients are contacted by telephone once a week for 4 weeks, covering a total of between 28 and 30 days. During this follow-up period, patients may experience unwanted outcomes, such as bleeding events, thromboembolic events, or death. As soon as you're aware of one of these outcomes, complete the corresponding event form and an adverse event form. Please scan and email these forms along with de-identified source information to Joanne Duncan and make sure to enter the event into the REDCap database. So let's move on to some frequently asked questions. What if the patient went on their DOAC 2 weeks ago? They are still eligible for the study because they have had ample time to follow interruption protocol. What if the patient is having a procedure outside the hospital and the coordinator knows before consenting that you won't be able to get a blood sample? Can you still enroll the patient? No, you cannot enroll the patient if you are unable to get the blood or if the patient is unwilling to give the blood and you know this beforehand. If on the day of surgery blood is missed, then it is okay for the patient to remain in the study. What if the physician or surgeon says it's a high-risk surgery, but the guide says that it's low risk for bleed? For us, the guide is just that, a guide. Ultimately, the bleed risk is up to the preoperative MD. What if the physician agrees on the surgery risk but doesn't agree to the interruption protocol? Let's say that they want to stop the DOAC for 3 days prior instead of 2 days prior. Then this patient would be discontinued, as the patient or physician is unable to follow the interruption protocol. What if the patient's surgery is canceled and rescheduled to a known date? Verbally consent that the patient will continue and keep them in the study with the same patient ID. When they have their future surgery, enter the actual date of surgery in the surgery visit and the actual date of DOAC interruption, and then click No to the question, was the actual surgery date the same as the planned surgery date? Follow up 4 weeks from the date of surgery like usual. What if the patient's surgery is canceled on the day of surgery permanently? Since the patient interrupted their DOAC before surgery, this patient would remain in the study for follow-up. Follow-up as per usual. What if the patient's surgery is canceled permanently before the patient was to stop their DOAC? Since the patient did not interrupt their DOAC and they did not have surgery, then the patient is discontinued. No follow-ups are necessary. And then finally, what if you can't get a hold of the patient on day 7 post-op? If the patient can't be reached on day 7, try days 8, 9, or 10. If the patient cannot be reached on day 10, wait until day 14 and try again to ask them about the previous 2 weeks. In this way, some follow-ups may be conducted on the same day. This concludes the PAUSE 2 RCT protocol review video. Please take a look at some of our other PAUSE 2 RCT videos, including practice scenarios for both PAUSE and Azra and an introduction to REDCap. Thanks for watching!